Dear chairs, dear colleagues, I would like to present my PhD topic, the novel treatment approaches in penile cancer. My name is Judit Vargha. I'm a urologist and andrology specialist. I work at Semmelweis University in the Department of Urology. My supervisors are Peter Rees and Peter Nyiradi. My SMS is Jakub Hoferica, and my statisticians are Mikolt Bakony and Péter Fehérvári. My mission is to search for a more effective therapy for advanced penile cancer patients and thus improve their life expectancy. We have three topics related to penile cancer. The first one is the comparing the efficacy and safety of immunotherapy with chemotherapy in penile cancer patients. A systematic review started last September. The second one is the investigating the effectiveness and safety of penile cancer immunotherapy versus chemotherapy, the penile study. This is an international survey. And the third is to investigate the reasons for prolonged denial in patients with penile cancer. My first topic is comparing efficacy and safety of immunotherapy with chemotherapy in penile cancer patients. As a background, I would like to highlight that penile cancer is a real disease. Its incidence is low, but it's notably higher in underdeveloped countries. The 5-year survival is 67%, but we can see a big difference if we differentiating between localized and advanced cases. Unfortunately, most patients seek medical advice late when the tumor is in the advanced stage. For these patients, the first-line treatment following surgery is chemotherapy. Most of the penile cancers have squamous cell carcinoma, and nearly half of them express PD-L1. This can provide in the future further therapeutic options. These therapeutic options has been exploited in dermatology. In case of skin squamous cell carcinoma, the first-line treatment is immunotherapy. And if immunotherapy is a good therapy in other localization, it can be effective in penile cancer too. We aim to investigate the effectiveness of immunotherapy in penile cancer. Our clinical question was, is immunotherapy more effective and safer than chemotherapy in patients with penile cancer? Our population is penile cancer patients for whom we like to compare immunotherapy and chemotherapy in terms of efficacy and safety. Our hypothesis is that immunotherapy is more effective and safer than chemotherapy. The clinical implication of our study would be to introduce immunotherapy into daily practice in penile cancer patients to improve quality of life and prolong survival. With our systematic search, we found more than 4,000 articles in 3 databases. The first domain of the search key contains the condition, the penile cancer, whereas the second domain contains the therapeutic options, immunotherapy, and chemotherapy. In this diagram, you can see our selection flowchart with an initial number of 4,029 articles. In the end, we find 54 articles, and after the selection protocol, we search for citations, and we found more 3 articles on our topic. Regarding our eligible articles, I would like to highlight 2 points. The first one is low number of patients treated with immunotherapy, as penile cancer is a real disease and has a low level of evidence in the guidelines, the therapy. And the second one, we didn't find any articles which compared immunotherapy with chemotherapy in the same article. So therefore, we decided to make an indirect comparison after the data collection. For the first analysis, we used only the studies where individual patient data were available, and this is our first results. In the upper plots, you can see the immunotherapy results, and the lower plots, the chemotherapy results. Our first outcome was the best response rate. In the first column, you can see the number of best responders, and on the left side of the plot, we can see the proportion and poor proportion of best responders. If we compare the 2 results, it can suggest that objective response rate is the same in the 2 treatment arms, but I have to highlight it again, it's just preliminary analysis, and we have a lot of data remain, and will be added to the analysis. Our second outcome was the progression-free survival. For the measurement to progression-free survival, we use months. In the plots, we can see the number of population of the study, and in the left side, we can see the main progression-free survival. If we compare the two results, it suggests that chemotherapy is a much more better therapy than immunotherapy. But I would like to repeat, this is preliminary analysis, and we have more data, and it will add it to the model. Summarizing our results, it seems promising if you just look at the immunotherapy results. The limitations of our studies, we didn't find any RCTs, just single-arm retrospective studies. We have a low number of patients treated with immunotherapy, and the population is very heterogeneous according to the tumor stage, the treatment line, and the treatment protocols. The strengths of our study, this is the first systematic review and meta-analysis in that topic. Majority of immunotherapy articles, the individual patients that are available, and this is the largest patient population to date to evaluating the efficacy and safety of immunotherapy in penile cancer. This is our flow chart, the progress chart of our first topic. We are in the data analysis phase. My second topic is investigating the effectiveness and safety of penile cancer, immunotherapy versus chemotherapy, the PENCIL study. The background is same as the previous one, but I like to repeat. The survival with advanced penile cancer is very poor. In the guideline, the first-line treatment is chemotherapy, and yet immunotherapy just mentioned with very low level of evidence. In case of skin squamous cell carcinoma, the first-line treatment is immune checkpoint inhibitor therapy since 2018. Based on this, we started to treat our patients with cemiplimab with an immune checkpoint inhibitor drug after individual equity request, and we use it as a first-line treatment, and we plan to collect patients' data in an international level through a survey. Our question is, immune checkpoint inhibitor therapy effective and safe in penile cancer as first-line therapy? Our population is advanced penile cancer patients. We like to compare chemotherapy with immune checkpoint therapy in terms of efficacy and safety, and we hypothesize immune checkpoint therapy is more effective than chemotherapy in penile cancer, and the clinical implication of our study would be to introduce immunotherapy as first-line treatment for patients with penile cancer to improve quality of life and prolong survival. Our topic is feasible, and now we are in the questionnaire and protocol writing phase. Summarizing my topics, the first we want to submit in this year, the second in the next year, and we are started the third one in the end of this year. And finally, I would like to thank you for your attention with a quote with Terry Pratchett: "It doesn't stop being magic just because you know how it works." Thank you.
Thank you very much for this nice presentation. And the questions, yes, we are waiting the questions.
Hello, I wanted to ask you how many of these patients have also an HPV infection? And a second question, I know that the vaccine is also recommended to men, but I really don't know how many men actually get vaccinated.
Yes, we have data about the HPV infection rate from the histology. Nearly the 40% of patients had HPV expression in the tissue. And in Hungary, there's no preventive HPV vaccination for months.
I would like to ask if a surgeon have to do or has to do surgery on the penis, is there like a reconstruction technique? Because you know, your project and mine are quite similar in the way that this affects also their mental health and sexual well-being, as in my project. So is there a reconstruction technique after these surgeries?
Yes, there's a level of surgery after we can perform reconstruction, for example, glands resection. But in case of penile amputation, we don't have a chance to make.
Of course, yes. Thank you very much.
Congratulations. I just want to add that there are vaccinations for men in Hungary for HPV.
We can.
Especially Gardasil 9 is the.
Yes, if the
or
patient.
Silgard or Savarix.
Yes, if the patient asks for vaccination, we can describe him and we can start
Yes. Yes.
My question regarding your first topic, that if I can see it clearly, that the progression-free survival is more high, it's around 20 months for chemotherapy, and it's much lower in the immunotherapy. What was the reason for that?
Yes, thank you for your question. If we compare the two results, it's more than it's nearly 10 times better therapy according to this. But if you check the population of the chemotherapy articles, the patients had lower cancer stage, and before the therapy, they had complete surgical resection. So maybe that's, and we have just 17 patients in the chemotherapy arm yet.
Okay, thank you.
Thank you.
Congratulations for your presentation. I would like to ask that are there more immunotherapeutic agents which you investigated, and if there are you planning to compare them with each other regarding to their effectiveness?
Yes, thank you. This is one of the difficulties of our study, because in every center they use different immune checkpoint inhibitor. And if we will get enough data, we will do the subgroup analysis.
Thank you, Judith, for your presentation. I have one question, of course. We will wait for the final analysis. I think that would have really high clinical relevance in this field. My question is about the availability, actually, about the immunotherapy in Hungary, for example. Is it available? And if yes, do you know how much it costs?
Yes, is it available? But we have to write an equity request for each patient, because it's an off-label therapy now. And about the cost, I don't know.